Well, Sheriff Sam, this is certainly not the time that you want to be admitted to an emergency room, as these hospitals face an influx of patients as well as longer wait times. Now, we're told that there are nearly 40 patients here at Arrowhead Regional in Colton where people are still waiting for hospital beds, and this is something we are seeing across the board.
We are still struggling with bed availability. The hospitals are full.
A widespread problem. Hospitals are full and many ICUs at capacity, with staff overworked as they deal with the surge and many of their co-workers out due to COVID.
We've got more staff members out, more resident physicians, more nurses, more techs.
We had about as high as 10 to 12% of our staff that were testing positive. And again, they need to be off work to recover from that. That percentage is now coming down, but it's still, not zero.
Patients now dealing with longer wait times across the board. At Loma Linda Medical Center, these surge tents and a field hospital are sprawled outside of the emergency room as a backup.
We're over 100% capacity on our ICU beds. We have more patients in ICU level than we actually have official ICU beds. So we've turned some of our acute care areas into ICU beds, and we're using some of our post-surgical recovery areas as ICU.
Dr. Adrian Cotton says they're trying to provide breaks and extra meals for staff to boost morale.
I think the other big difference that we're seeing now compared to December of last year, when we had the big surge then, is this has now gone on for 20 months. And there's no end in sight.
The COVID surge putting a strain on hospitals statewide as we near the 2-year mark into the pandemic. And with the Omicron variant raging on, it's unclear if we will soon move from a pandemic to an endemic stage where the virus is controlled. Top health officials offering contradictory statements. In an interview on CNBC, former FDA Commissioner Scott Gottlieb saying Omicron could signify an end stage due to widespread immunity.
I think the base case is that this signals the end of the pandemic phase of this virus.
But top infectious disease expert Dr. Anthony Fauci saying otherwise.
I would hope that that's the case, but that would only be the case if we don't get another variant that eludes the immune response to the prior variant.
The question, will Omicron be the final stage? Still unknown. In the meantime, as healthcare workers battle through the surge, there's one thing people can do to help.
Do not go to an emergency room for a COVID test.
Shelby, I'm sure many people are nervous about the rise in cases. So what can people do to get at-home COVID tests?
Well, the U.S. Postal Service is now taking orders. People can visit covidtests.gov to place an order, or you can even visit our website, ktla.com. We'll have that link as well as additional information. Now, a couple things you need to know. There are 4 tests limited per household, and these are rapid antigen tests that you can take home. They will give you results within about 30 minutes. Reporting live in Colton, I'm Shelby Nelson. I'll send it back to you.